Today's post is about breathing. Breathing is an important part of many of the protocols that I have written at Vibrant Health Company. So it's included in the series called Vibrant Mind, which is a cognitive behavioral therapy coaching program. I was going to say problem, but maybe it is a problem until we're breathing properly and using the right skills. So breathing is included in the Vibrant Mind cognitive behavioral therapy program, and it's also heavily featured in the Trauma Solutions program. Correct breathing is so important, and actually it has been shown to be as effective as medicine when clients can use this properly and wedge that in before a panic attack starts. You'll know that the first thing that you do when you're facing an important task is to take a deep breath. If you're in pain, you often focus on your breathing. If you're exercising, you're focusing on your breathing to help you through. Breathing is a wonderful natural healing power that we have, and pair that with the mind, and you have, as I said before, at your disposal two very powerful tools in the fight against stress, depression, and anxiety. There's lots of information online about how to breathe, and a lot of the techniques shown online focus on the counts that you have to have. So they tell you to breathe in for a certain number of counts, hold the breath for a certain number of counts, and breathe out. Really what's more important is that you learn about the rhythm of your body when you're breathing. And how you can do that is you can get into a quiet space and put your feet on the floor, relax your shoulders and arms, and from there your heart rate might be racing a little bit if you're going from activity to focused breathing. But when you sit or lie down on the floor, the idea is to put the hands over the belly so that you can feel the belly expand nicely as you take a deep breath in. And as you take a deep breath in, the rib cage and the lungs also need to expand along with the belly. And then you might want to hold the breath for just a moment and breathe out, and everything kind of contracts. So as you breathe in, everything expands, and then as you breathe out, everything contracts. So what we're looking for with correct breathing is a good amount of relaxation through the chest, the shoulders, and all through the solar plexus right down to the belly. It's important to use the belly for breathing because that's going to help you get the most oxygen in and the most toxic stuff out. Also bear in mind that the belly has more neurotransmitters, especially when we talk about serotonin. It has more neurotransmitters than the brain. So that might cue you in as to why you want to make sure that when you're breathing, you're getting some good stuff down here. You're making sure that that belly is expanding and contracting properly. So as you get to know your breathing, you'll notice that when you're stressed or anxious or tense, your breathing rate increases. And people often say that when the breathing rate increases, they feel the breath caught in the throat and chest. They notice tension all through the neck and shoulders, and some people even get headaches when they're not breathing properly. So as you're learning about your body through these Vibrant Mind skills, or if you're in the Trauma Solutions program, the important thing is to be intuitive and to really figure out where the tension is held in your body, and to try to focus on breathing in and expanding and out through that tension. So along with the counting, there's all kinds of information online about whether to breathe through your mouth or your nose, or whether to use a type of breath called Ujjayi breath, where you breathe back through the back of the windpipe. I think what matters more is just that you're relaxed as you're breathing. You're making a nice space in the body and in the mind while you're breathing, which brings me to another thought. One of the great things about breathing is that it helps us to not be impulsive. So it actually helps pace the thoughts. It helps us to figure out if a thought is helpful or not. And when we notice a thought is not helpful, obviously we can challenge that thought with a reframe or thought stopping. So again, where to breathe? If you got clear nostrils, breathe in slowly through the nostrils. Expand the body and breathe out gently through the mouth. Again, the counting and where you're breathing is not as important as giving yourself a slow pace and a chance to think about where the tension is held in the body. A couple of tricks for you, tricks and tips about breathing. When you do start your breathing practice, remember to relax the jaw. A lot of tension is held here. Try to relax the brow and the eyes in the sockets, and also drop the tongue to the bottom of the mouth. There's a lot of tension actually that we hold in our face, as well as our neck and shoulders. And so if you come into your breathing practice, really try to focus on relaxing those parts of your body, as well as we've talked about the chest down through the solar plexus and right through the belly. Now, how long should you breathe when you're starting to practice? Obviously, the best outcome is that you're breathing deeply in this way throughout the day. But most people that just start their breathing and mindfulness practice are not breathing that way throughout the day, and they are actually constricting their breathing. So in order to get your body used to doing this, I invite you to sit just for 5 minutes or 10 minutes, maybe in the morning or before you go to sleep at night, and get in touch with this breathing practice. The more that you practice, the more that your body will know what to do when you notice that your breathing is slightly off. And the more that you know what to do, the more easily it will come to you to breathe properly. Now, when clients do start to breathe like this and they're in the middle of a lot of stress in their life, or they have anxiety, they will say that their heart is racing when they're trying to breathe more slowly, and that's okay. So the idea is that the mind is unquiet. That's a burden of consciousness. But the self, the mindfulness, is separate from the unquiet mind. And similarly speaking, the heart can race even though the breathing is at a good rate. So just let the heart race and focus right down your center on being in the moment, intuitive, mindful, and slowing your breathing. So good luck. Breathing is so important for your health. Please try it, and look for my other videos about mindfulness and cognitive behavioral therapy in your effort to have a vibrant mind.